All right, welcome to The Explainer. Today, we are diving deep into a world most of us never even see. It's healthcare's most critical battle, and it's happening all around us. We're talking about the principles of asepsis, the invisible strategy that literally saves lives.
So let's start with a really big question. In any healthcare setting, the most dangerous enemies are completely invisible, right? We're talking bacteria, viruses, spores, a microscopic army. So how in the world do you fight a war against an enemy you can't even see? Well, that's exactly what we're going to break down.
Okay, so in this war, there are two clear sides. On one side, you have the threat. That's sepsis. This is what happens when the enemy gets through our defenses. It's the nasty breakdown of living tissue caused by these microorganisms. And on the other side, that's our defense. That's asepsis. It's the goal. It's the strategy. It's the state of being completely free from those invisible invaders. It's how we win the fight.
Now, before we get into battle tactics, we've got to learn the lingo. You can't really understand the game plan if you don't know the key terms. So let's lay the groundwork for this war on microbes.
First up is the term antiseptic. The two most important words here are living tissue. This is the stuff that's safe to use on people. Think about the hand sanitizer you use when you walk into a hospital, or the mouthwash a dentist gives you. It's all designed to stop microbes from growing and multiplying on you.
And its partner in crime is the disinfectant. The key here? Inanimate objects. We're talking about countertops, surgical tools, doorknobs, all the stuff around you. So antiseptic is for skin, disinfectant is for surfaces. Same mission, just a different battlefield.
Now, this concept is a big one. Sterility. Think of it as total victory, the end game. And what's so interesting is that it's an absolute state. There's no such thing as kinda sterile. An object is either 100% free of all living organisms or it's not. It's completely black and white.
Sanitization, on the other hand, is a totally different ballgame. This isn't about total annihilation. It's about risk management. It means reducing the number of germs down to a level that public health officials consider safe. Think about a restaurant kitchen. It's not a sterile operating room, for sure, but it is sanitized to keep everyone safe from getting sick.
Okay, we've got the vocabulary down. Now it's time to meet the villains of our story. Let's do some recon and profile the key adversaries that healthcare professionals are squaring up against every single day.
First on the list, hepatitis B, or HBV. And let me tell you, this one is a real heavyweight. It's a huge risk, especially in dentistry, because it's not just in blood, it can even be in saliva. And this virus is tough. I mean, it's super resilient. It just laughs at being dried out and can shrug off common disinfectants like alcohol. To take this thing down, you have to bring out the big guns. We're talking intense heat or powerful chemicals like bleach.
Now, let's contrast that with HIV. And this might surprise you. Obviously, it's incredibly serious once it's transmitted, but the virus itself, outside the human body, well, it's actually kind of wimpy. Unlike HBV, it's really unstable and fragile. It can't stand being dried out. It's a great reminder that not all viruses are built the same. They have different strengths and weaknesses.
And then there's tuberculosis, TB. This enemy changes the rules entirely because its primary attack is airborne. It travels through the tiny droplets in the air we breathe. And just like hepatitis B, it's tough as nails, super resistant to drying out and a lot of chemical disinfectants. This is exactly why, if a patient has active TB, any non-emergency dental work is postponed. It's just too big a risk for everyone else in the building.
So you've got all these different enemies, right? One is super tough, one is fragile, one is airborne. You can't possibly have a different playbook for every single one. What you need is a universal strategy, a single core rule that governs everything you do.
And this is it. This one sentence is the golden rule. It's the foundation of all modern infection control, and it's a concept called universal precautions. Now, this isn't about being paranoid. It's about being prepared. It's a fundamental shift in mindset that creates a consistently high standard of safety for absolutely everyone, no exceptions.
And this is what that mindset looks like in action. It's simple, really. You don't guess and you don't assume. If any surface has been exposed to blood or other bodily fluids, you treat it like it's infectious. End of story. Every single time. It completely removes guesswork from the safety equation.
So, we have our strategy. Now it's time to check out the weapons. What's in the arsenal that lets healthcare teams put these rules into practice and actually achieve that state of asepsis?
So the arsenal basically has two primary modes of attack. We've seen these terms before, but now let's think of them as actions. First, you have sterilization. That's the full-scale assault, the complete elimination of all life on an object. Then you have disinfection.
Think of that as more of a targeted strike, used to knock the threat down when total, absolute sterility isn't required.
So how do we get to that 100% totally sterile state? Well, the main weapon is a machine called an autoclave, which uses moist heat. It's basically a pressure cooker for microbes. It uses incredibly hot steam under high pressure to denature their cell proteins. You know how when you cook an egg, the clear part turns white and solid? It's kind of like that. It's basically cooking the germs so intensely that their insides fall apart. The other methods, like dry heat and gas, are for more delicate items that just can't handle all that steam.
And this is a super important point, so listen up. You might think, hey, can I just boil things to sterilize them? And the answer is no, not for true sterilization. Sure, boiling water kills a lot of germs, but some of the toughest spores and viruses out there are like little armored tanks. They can actually survive a simple boil. The autoclave, with its combination of high pressure and steam, reaches temperatures way above boiling, and that's what guarantees a 100% kill rate.
Okay, so we've covered the terms, we've met the enemy. We have our strategy, and we've seen the weapons. For our final section, let's head to the front lines and see how this all comes together in practice.
It all begins with the most basic but also the most critical procedure: hand hygiene. These are the official CDC guidelines, and every single step here matters. But I want you to pay close attention to steps 3 and 6, the vigorous rubbing and using the paper towel to turn off the faucet. Why? Because if you touch that dirty faucet with your perfectly clean hands, you've just recontaminated them and undone all your hard work. These are the 2 steps people mess up all the time.
Seriously, if you remember just one number from this entire explainer, make it this one, 15. A minimum of 15 seconds of vigorous rubbing. It's that friction and time that physically dislodges and helps kill the microbes. A quick, lazy rinse doesn't cut it. Here's a tip. Next time you wash your hands, sing the happy birthday song through twice. That's just about the perfect amount of time.
And what about gloves? They're a critical barrier, but they are not magic. The absolute #1 rule is that gloves are not a substitute for hand washing. You wash your hands before you put them on, and you wash your hands right after you take them off. They are a single-use tool designed for one task, and the second they get damaged or the job is done, they go in the trash. And this brings us right to the ultimate goal. Every single action we've talked about, the hand washing, the sterilization, the gloves, the universal precautions, it's all designed to do one thing: eliminate cross-contamination. It's all about breaking that potential chain of infection between the team, the patient, and the environment. It's about creating a safe, controlled space where healing can happen. So there you have it. You've now had a look behind the curtain at the constant, invisible war being waged in healthcare every day. I guarantee the next time you walk into a dentist's office or a hospital, you're going to see things in a whole new light. The hand sanitizer, the packaged instruments, the way professionals handle their gloves, you now know the rules of the war. So my question to you is, what will you see differently?